Welcome to The Health Line, issues that shape our well-being. I am your host, Dr. Andrea Ault-Brutus. In The Health Line, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. October is Breast Cancer Awareness Month, and I'm thrilled to have the director of the Northwell Health Cancer Services Program, registered nurse, Sara Parise, on our podcast. So welcome to the Health Line, Sara.
Thank you. Thank you for having me.
Of course, we're happy to have you here. So I know that you're the director of the Cancer Services Program. Can you let us know more about that program?
Right. So the Cancer Services Program is a New York State Department of Health funded program that we here at Northwell Health are the contractors of at Long Island Jewish Medical Center. And the program provides no-cost cancer screenings to uninsured or underinsured individuals, regardless of their immigration status. The cancer screenings that we do provide are breast, cervical, and colorectal cancer, and we have multiple sites here around Nassau County that we can send patients to any location.
So you mentioned that your target population are those who don't have insurance or maybe underinsured. So I guess, what can you tell us more about that? Why are you particularly concerned about that vulnerable population, those who don't have health insurance, or they may have health insurance, but they don't have full coverage?
So really the program is aimed for early detection and to really fill up a gap in care for these patients. So if we have somebody that's uninsured that's coming in for their regular screening and they get diagnosed, they will get diagnosed at an earlier and more treatable stage for their cancer. So we really want to make sure that everybody is staying up on their healthcare screenings. Again, like I said, early diagnosis equals a better outcome for cancer. So we really want to make sure that, like I said, we are really trying to diagnose these cancers as early as possible. For breast cancer specifically, for colorectal and cervical cancer, we can actually prevent cancer from happening. We can remove precancerous lesions that can prevent cancer from even evolving in that particular person, which is really important because then we can really stop a diagnosis from happening.
Yeah, very true. And so you mentioned breast cancer. And as we all know, this is Breast Cancer Awareness Month. And can you tell us, the audience, what are the current screening guidelines for breast cancer?
So there are many different governing bodies here in the United States that give us guidelines. One is the American Cancer Society, and the one that we really follow for the Cancer Services Program is the United States Preventative Task Force. And up until recently, the United States Preventative Task Force had really given the guideline that those above 50 should be screened on a regular basis. And then they really changed that recently to be more in line with the other sources, to say that we should really start screening breast cancer at the age of 40 and to screen at least every 2 years, if not every year. And if somebody has a cancer history in their family, for them to start screening 10 years before their relative that had breast cancer. So say your mom had breast cancer at 39 and you want to go get your cancer screening done now, you should actually really start at 29 because we really want to make sure that people that have a cancer history in their family are getting screened as early as possible. Also, even though the guidelines say that 40 is the age to start screening, we really want to make sure that people that are having symptoms, that feel something, that have a difference in their baseline of their body are really going to their providers and making sure that, they're getting those things checked out. We have plenty of younger women that have come in that have felt something. Some have turned out to be cancer, some have not. But we really want to make sure that even if they're younger than 40, that there is opportunities for them to be screened and to be seen by a provider.
And you mentioned in your previous statement that these women, they would feel something. And there's been, I noticed in the news, this shift. Should we self-examine or not self-examine?
Right. So there are no specific guidelines by a provider or by a governing body to self-examine. However, as a cancer nurse, I would say to make sure that you know your body. Do check your body different times of the month, different times of your cycle, to know what is, normal for you and for not. And if something feels different, if you have a pain somewhere, if you feel something, that's the time to go to your provider and advocate for yourself. Mm-hmm. We don't want to let anything go, but really get to know your body and get to know what's normal for you.
Okay. Or like a discharge or anything like that.
Right. So if you feel something, if there's bleeding from the nipple, if there's different types of flaky skin or dry skin around one side rather than another, if there's even a type of discharge that's only coming out of one side than another, definitely something that would be, you would talk to your provider about.
Or soreness. Yeah.
Yes, definitely.
Okay. You talked a little bit about the risk factors. So what are some of the major risk factors that we should look out for to say, you know what, I definitely need to get a screening? I know you said the guidelines say starting at age 40, but what are some other risk factors that people should think about?
So there's many other things that one should think about with risk factors for breast cancer. So there's some things that we can change and some things that we can't change. We can't change our family history. Mm-hmm. We can't change if other folks in our family have been diagnosed with cancer. That would increase our risk and that would make us get screened earlier. Some things that we can change, though, however, are our lifestyle factors, where we can make sure that we're not drinking so much alcohol, that we're making sure to exercise, that we're also getting screened for other cancers as well, making sure that we're up to date on all of our doctor's appointments and making sure that we're just healthy overall. There are different things that we can check and make sure of, during our family history. If there's genetic testing that's ever needed, can know that we might be at a different risk level, things like that. There are also other things that if one had radiation to their chest before, they could be at risk for breast cancer in that radiation area that they might have been treated for Hodgkin's disease or something like that. Never having children is also a risk factor because our bodies are not being protected by those hormones. Also, having your first or only child at an older age.
When you say older, what do you mean?
No,
just at what age?
Right. I'm just talking about the pregnancy really protects ourselves sometimes with those hormone levels. And if we're getting older, those hormone levels are decreasing, so it's just less protection.
So like maybe after 35?
Maybe after 35, maybe after 40. Also, never breastfeeding is a risk factor. We want to make sure that, breastfeeding is positive in many different ways, but it also can protect us from breast cancer as well. One of the other risk factors, too, is also for women menstruating at an earlier age and going through menopause at a later age, which also means our bodies have been exposed to those hormones for a longer period of time, too. So there's a lot of things that we have to take into account. As women, we are so responsible for so many things in our life, but we really want to make sure to be most responsible for ourselves and our health.
Very true. So one thing I heard recently in the news is that there's been these changes in the guidelines in regards to dense breast. Can you let us know what are dense breast? Why is it a risk factor for breast cancer? What, if any, additional screenings are necessary if you have dense breast?
Right. So to answer the first question, dense breast is when there is more fibroglandular tissue in the breast. On mammogram, which really kind of looks like a cloud, it looks like an x-ray picture of the breast when the radiologists take a look at it. The denser the breast, the whiter and thicker that cloud is on that x-ray, on the mammogram vision. And it's sometimes harder for them to see little teeny tiny, lesions or anything that they would really want to follow up on. But on top of that, too, they're also saying that the breast density as well could also be high risk because you have more of this tissue in your breast. So it's twofold. One, that they can't see it necessarily, and two, that may increase your risk as well. So one of the things that has recently come out is that any mammography institution is required to let you know your percentage of breast density. So there's a scale when they look at it, when the radiologists review them. And if your breast density is over a certain percentage, you might be eligible for some other cancer screening test, like an ultrasound, possibly an MRI. But when you get your letter for your mammogram, it should say your percentage of breast density is this, and we recommend you doing this and this and this. Sometimes some insurances may or may not cover these additional tests. And again, that's why the Cancer Services Program is here, because like you said in the beginning, if somebody has an insurance that only is covering preventative testing, but they're not necessarily covering diagnostic testing, the Cancer Services Program can come in and cover those tests because we want to make sure that everything is being done for that patient at that time, and we're not leaving anything overturned as far as if we could diagnose cancer or not.
Okay, great. Thank you. I did have one other question for you in terms of 3D screening. What is the advantage of using a 3D mammogram versus a 2D mammogram?
A 3D mammogram right now is really the standard of care for most mammogram places, and especially here at Northwell, where we provide that as well. But it's like if you're looking at a TV screen or you're looking at something sitting on the desk, you can see much more around that tissue. You can see exactly what's going on in the breast. They still only take 1 or 2 pictures on the screening mammogram side. And what they do is they take all of those pictures together and they make it into a 3D image where the doctors can really take a look at that and they can really see what needs to be followed up and what doesn't need to be followed up. The 3D mammogram itself in the most recent years has actually decreased the amount of biopsies that have been needed because they can really see that something is benign, that something doesn't need follow-up, rather than, somebody going through an unwarranted biopsy because they couldn't see what it looked like on a 2D mammogram.
That's great. Because of the 3D mammograms, now we have this decrease in the need for those biopsies. So that's great. So in terms of someone goes in for the screening, what if they do find something? What does the Cancer Services Program provide those individuals where they did the mammogram or they did the ultrasound and there's something that's found? What's the next steps for that individual?
So luckily, the Cancer Services Program covers all screening and all diagnostics up until the time that somebody gets diagnosed with cancer or not. So for breast cancer specifically, somebody comes in and gets a screening mammogram done and they need some follow-up done. Then we would go ahead and we would cover that diagnostic testing. We would cover the ultrasound. We would cover the biopsy. The Cancer Services Program covers up to, like I said, the time that either breast cancer is diagnosed or not. And if breast cancer does get diagnosed, we have resources for those individuals that can either be enrolled to certain Medicaid programs, certain special state cancer programs. So we're not leaving anybody without care. This also goes to the colorectal and the cervical cancer portion of it as well, where we're covering everything up into screening, up into the time of a proven diagnosis or not.
Great. Say we have someone who's listening to this podcast and they believe that the CSP program is a good program for them to call. How can they get in touch with the CSP at Northwell? And I understand that CSP is throughout New York State, right? So even if they're not in this Long Island area, they could go to a CSP in another part of New York State.
Correct. So luckily, the Cancer Services Program is a program that covers all of New York State. Northwell Health happens to have 3 contracts out of 21 that is provided by the State Department of Health. If somebody wants to come into any of our Nassau locations, they can give us a call at 516-470-4165, or they can email us at csp@northwell.edu. We can then screen that individual for what location they would like to go to and what cancer screenings that they would need. Like I said, we have many locations here in Nassau County, but we can refer them to any of our sister programs in the state for anywhere that they live.
Oh, great. And the 3 that are in this area that Northwell covers, where are they located?
So we have our sister programs out in Suffolk County, and then we have another program in Staten Island.
Okay, great.
That's also not to say that there are other Northwell locations, say in Manhattan or Queens, that are credentialed under the Cancer Services Program that we can also refer them to as well.
Great. So what other services does CSP offers?
So 2 of the really exciting things that the CSP offers to the community is one of the things is that we have a community outreach educator who goes out into the community, into specific targeted communities that we're looking at that are specifically underinsured, uninsured, low income, to let people know of the cancers and why they should be screened for them. No one's going to come in for cancer screening and not understand, why they have to come into a specific doctor's appointment. So we're really hoping, and we really have have been working on bringing this information to the community. We talk about breast cancer, we talk about the risk factors, we talk about why somebody should go in for screenings, and then we give them options and say, we've given you this information. This option is here for you to be able to come in and get your cancer screening done, insured or not. If they're insured, we will refer them to our regular breast imaging center where they can go and get their mammogram and cancer screening done. And then if they're uninsured, they would come into our program and then we would follow them. One of the other really exciting things that the program offers is case management and navigation. So anybody that has an abnormal screening that's coming through the program, they have a specific navigator, individualized care for them to kind of go through the whole process, the diagnostic process, for them to be able to go through. They help them with appointments, they help them scheduling things. They also really bring in a lot of different community resources and community things that they may need as far as transportation, financial aid, food banks, childcare, different things. So we're really looking at the patient as a whole and not just for their cancer screening. We're really trying to look at all of the social determinants of health for that patient and to be able to help them overall as an individual.
Great, thank you. And one thing I've noticed about CSP is that you meet people where they are, which I think is great. So can you tell us more about the mammography vans that go out into the community?
Right. So we know that this is a very vulnerable population. This is not a population that trusts the healthcare system, that, really wants to be able to come in for their cancer screenings. They don't understand, exactly why they need to come in. So unlike our community outreach educator that goes out into the community and educates, we also take some of those specific cancer screenings and bring them to the community. One is a mammogram van, and we work with different institutions that schedule the mammogram van to go to different locations here in the county, and somebody can get a mammogram, walk right up, get their mammogram done, get their results right away, and walk away and be done. This really helps with a lot of transportation issues. It helps with other barriers to care. And then if somebody needs follow-up after getting a mammogram on one of the vans, they can go to any of our cancer screening program locations and get follow-up for that. Another thing that we also do is for colorectal cancer screening, we bring something called a FIT kit out into the community. A FIT kit is a test where it tests for blood. So someone can get this FIT kit out in the community, do the test, they mail it back to the lab, and if something comes up in that test, then we will call them to come in for colorectal cancer screening or diagnostics. But again, 2 out of the 3 cancers that the cancer screening program screens for, we can bring those screenings directly to the community, which not only increases the number of screenings that were being done, but we're increasing and decreasing the rates of cancer for the community.
Great, thank you. So as we are wrapping up Breast Cancer Awareness Month, what are some parting words that you want to share with our audience?
So one thing that I do want to let the audience know is that, October is Breast Cancer Awareness Month. We do see, pink all over the news. Everybody has pink on. I have my pink sneakers on today. But we really have to remember that, breast cancer is also here for the other 11 months of the year. We can focus on October. We can focus on Pinktober. Really, it's all year. And to make sure that, not just come in for October and not just come in for when, it's all over the news and all over everywhere else. But we want to make sure that people are coming in for their screenings no matter what. And that, breast cancer is sort of on the forefront of everybody's mind the rest of the year.
Thank you so much, Sara, for joining us today on the Health Line. And thank you for shaping our well-being and for all that you do in the community. It's very much appreciated. My name is Dr. Andrea Ault-Brutus, and we appreciate you listening, and we look forward to seeing you next time on the Health Line.